Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. The CareCredit credit card can help you get the look you've always wanted now. CareCredit is offered at hundreds of thousands of locations nationwide for things like cosmetic surgery, injectables, and other beauty procedures. Today, we're in Los Angeles, California with Dr. Shirley Soleiman. Dr. Soleiman is a board-certified physician and injectables specialist and the founder of the Cosmetic Injectables Center in Sherman Oaks, California. Today, we'll be discussing PDO threads. Thank you so much for joining us today, Dr. Soleiman.
Thank you for having me.
So can you tell me what exactly is a PDO thread lift?
PDO threads are polydioxanone threads. It's just a polymer that makes up the thread itself. And they've been used for decades in surgery in terms of doing sutures and correcting cuts and wounds. So if you've ever had a suture, then you would know what they are, right? They've been used. So while using those, they found that it elicits a lot of collagen. So afterwards, the skin is thicker and firmer, and it just looks less bendable. So someone had a brilliant idea of loading it onto a needle and just inserting it under the skin so that they can promote the collagen and get the same firming effect. And that's how threads came about on needles. And then to take it a step further, they added some barbs onto that thread. And so when inserted, we can actually tug on it and create a little bit of a lifting effect while promoting collagen to hold it in place.
So I know you were kind of just getting into that, but how exactly would the procedure work?
So yes, we have to first determine what kind of lift we want, what kind of pull we want. Some people need it to go back a little or up a little or diagonal and whatnot in different areas of the face. It could be the brows, it could be the jowls, it could be the nasolabial folds. So once we determine what kind of lift we want, or it could just be thickening the skin and making it firmer. For example, under the chin, you can have a lot of droopiness, right?
Yeah.
So placing threads, smooth threads in this area can firm up the skin so it doesn't droop. So once we determine that, then we choose a thread of choice and we either tug, pull, or place it to create firmness.
Now, I know other people are probably wondering, but is this a painful procedure?
It can be if the right technique isn't used, but at this point we have so many modalities that we could reduce the pain. There is, you could put numbing creams, but in addition to that, you can inject beforehand the numbing. You can put the numbing inside of the thread syringe as you're injecting. You can numb as you go. You can use cannulas, which are not sharp, so they don't cut anything. So there's less pain with that. And then there's also the layer that you insert the thread. If it's placed correctly right under the skin in front of the muscle, then the pain is a lot less than if it goes through the muscle.
And how long do threads last? Is it something that you're gonna need like repeated procedures, or is it one and done?
A good analogy I use is if you have a house and you're trying to hold it up, how many columns do you need to make that house strong, right? Against earthquake, or in our case, running and moving, right? So the more columns, the better the hold. And so depending on whether you're using barb or smooth threads, for pulling, I always like to put it in at least vectors of 2 in each area so I can tie it and hold it in place longer. In terms of smooth threads, I like to use as many as possible because the more you place, the longer it lasts, the firmer it gets. It's not like Botox where you want to sometimes just prevent the aging of the skin. So every visit, I might pop in a few of them. But smooth threads last about 6 months, but the collagen it induces lasts about 2 years. Now, along that process, that timing, you can always add more. Same thing with pulling threads. You'll see some longevity of somewhere between maybe 4 weeks to a year. But you can always add more and tug more. And the collagen, again, in that case, lasts about 2 years.
We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on PDO threads. So let's talk about the safety. I'm sure a lot of patients have questions. Is there going to be any nerve damage expected to the face?
Nerve damage would be extremely unlikely because there's nothing like a scalpel or cutting that's involved. There's no instruments to cut anything. So you could potentially irritate a nerve or stretch a nerve, but it would be extremely unlikely that you could cut a nerve and cause permanent damage.
Is there, are you able to feel the PDO threads in your face at all?
Not the thread itself, but you will feel some tugging, potentially some aching, but the thread is usually not palpable, or at least you just don't feel it. Some puckering might be possible, some maybe tingling. If it is near a nerve, you might feel some tingling, but usually nothing drastic.
Would you say that the threads are more comfortable or just a little easier than fillers, like if you had to compare the two?
It depends on the person and which procedure you're doing. In smooth threads, for example, I'd say they're pretty painless. I mean, you don't really feel them at all immediately after. The threads that you're pulling with, which are the barbed threads, those you actually do feel the tugging, pulling for a while, and potentially the soreness.
And can threads also work with an eyebrow lift? Is that something that you can do hand in hand? Or
Especially now with the cat eye fad that we're having.
Yeah.
A lot of people like to get that that pulled look with the threads. Yes, they help, but I oftentimes like to work in a little bit of Botox to relax the muscles that could work against the thread. So if you've got a thread that's pulling the brow and then you've got a muscle that's pulling it against that thread, it may not make it as effective. So I like to use a combination.
So let's talk about the cost a little bit. How much do these procedures generally run with the PDO threads?
That's such a tough question because with smooth threads, there's twist threads, there's barbed threads, there's a number of threads you might use. You might do the whole face or you might do a few at a time. With smooth threads, I want to say, depending on which office you go to, somewhere between $20 to maybe $40 a smooth thread. With barbed threads, something about maybe $200 to $500 a thread. And a lot of times we use them in combination. So there's just like a whole face. Sometimes people do them by area, or they just do a whole face procedure, maybe priced at $2,000 up to maybe $6,000 or even $10,000.
Okay. And what financing options do you offer, does your practice offer?
We love CareCredit for our patients. It just gives them that ability to pay something over time. Credit cards are always a great option. And in general, we try to keep the prices low so that it's more affordable for our patients. So whichever way the patient chooses, normally we go with that.
And if you had to say one thing that's like your favorite part of your job, what would it be?
The relationship with patients and making them feel happy. That is very rewarding when you see someone hug you and say, "Thank you for changing my life."
That's amazing. Thank you so much for taking the time and joining me for this conversation.
Thank you for having me.
Thank you for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.